Hi, I'm Dr. Rahman, and welcome to Black Women's Health Podcast, where we are not afraid to ask the questions, to pull the cover off, to take a deeper look into those issues that affect us. Last week, I saw a deep fake with Viola Davis. She was talking about a diabetic treatment designed specifically for Black persons, designed by Black persons, and all you had to do was take this tincture, and it was fake. It was fake. It was her voice, it was her face, but the message was fake about a fake product. And the real problem was that this fake message, this deep fake, had more than 300,000 views and had been shared over 500 times. So we've entered a time where even when we see people that we love and trust and believe, the message may not be real. And this is because of AI generated deep fakes. And it's a problem. They're all over social media. And the real problem is that they're becoming so good that it's hard for you to detect when they're fake. Now, I was able to recognize the Viola Davis deep fake because of the message, because I knew that what they were saying was not true. And that's bothersome. But then there's another question occurred to me. Is there a possible benefit to the use of deep fakes in healthcare? And that's what I'd like to discuss a little more today. Imagine this scenario. Now, a deep fake is really a AI, artificial intelligence generated computer program which can superimpose a face on top of another face and clone a voice so that you can think that you're actually talking to a person when actually it's just an AI generated computer program. But imagine if your doctor had an AI generated avatar that you could talk to, let's say 10:30 at night, when you go to your patient portal and you see there's an abnormal lab result. What if your pap smear came back abnormal? What if it showed evidence of HPV and now you're upset because you know that HPV is sexually transmitted? You want answers. What if you could go to your doctor's AI generated computer program and talk to what would look like your doctor? You're talking to your doctor. You could ask your questions. You could get your answers all at 10:30 at night. Or imagine that you're a woman going through menopause and you're having all of these menopausal symptoms and you're not getting answers. But what if you could go to that AI generated menopause specialists and that you could then ask all your questions, discuss your symptoms, talk about treatment options, ask it and get the answers that you've been looking for. Wouldn't that be wonderful? Or imagine that you experienced a deep loss, or you have anxiety or depression, and you need the benefit of a therapist. And what if there was an AI generated computer programs of your favorite therapist who was there to answer your questions and to help you work through your depression or your anxiety or your grief? Well, those things are becoming available. But the problem and the things that we need to consider as these become more available is what if the computer programming includes inherent biases, such as Black women don't feel as much pain as white women, or Black people aren't as intelligent as white people. And what if these biases get put into these AR generated programs so that the answers that we get have these inherent biases? Or what if the AI program starts to hallucinate, which means just gives out bizarre answers? And what if you're talking about something really specific? What if you're asking about uh, a cancer treatment? Or what if it's about care of your child and it gives misinformation? Who's responsible for that? The program of the programmer who generated the AI program, or the doctor whose face is being used? Who is responsible for the misinformation? And you're sharing information. What about your privacy? Because you're not really talking to a person. This is a computer program. So what about your program? And so how do you deal with this? And while on one side, well, you can see that there's a benefit. It would be nice to be able to get answers at 10:30 at night and to have all your questions answered. Or you could ask that the person speak in your native tongue. Or if you're a Black person, you could say, I want the avatar to look like a Black woman, to look like me. That would be wonderful, wouldn't it? Speak in your native tongue, look like you. But what about the biases? And what about the misinformation? And what about the patient privacy? And who gets to see this? And how do we know that we can trust it? These are all really important issues that have to be worked through. And we need to work through them now because we already have many of these AI generated deep fakes in healthcare, with the potential that they will be used more and more as people start to see an advantage. And there are advantages, but we have to be clear that we have guardrails that will safeguard our health, that will make sure that um, we are careful to eliminate bias, that we control for AI hallucinations, that we figure out who's responsible for any misinformation that's given. These are really important questions because we are now living in a time where we can't always believe what we see or what we hear. And we need to be able to address these informations. When I consider the obvious deep fake of Viola Davis talking about the diabetes treatment, and I consider the potential benefit of deep fakes in terms of helping to give patients information, helping in terms of training healthcare professionals. I realize that the technology in and of itself isn't the problem. It's how we choose to use it and how we choose to safeguard our health and our health information. As I was working through this, I thought about creating a deep fake avatar of myself. It's possible. It's possible for me, someone that's not a computer programmer, to generate my own AI generated avatar. It would make generating podcasts, discussing key points, potentially easier, faster to do. And then I realized that I decided not to. Not because I'm afraid of the technology. I see the potential. I see the potential benefit. But for right now, I value what's real. And what you're getting from me is real and unscripted. I value the information, and I also value our relationship. So if what you've seen or heard today makes you think, raises questions, great. That's the beginning. Share it with other people, discuss it. It needs to be a conversation for all of us. And until the next time, I say, this is Dr. Rahman, the real Dr. Rahman, saying, take care.